Hi, in this video, I'll be discussing about the disturbances in size and shape of teeth. So, I'll be enumerating all those. Okay, I'll be telling you the specific clinical features of these different conditions, plus what teeth are affected, plus whatever probable questions can be asked from this topic, I'll be telling you, plus wherever possible, I'll be showing you some images, the characteristic images of those conditions. As you may expect the image-based questions also, on the basis of these conditions, you should be able to identify those. Okay, so now we will start with disturbances in size and shape of teeth. So first of all, we'll be talking about disturbances in size. Okay, so size, microdontia, the term is microdontia. Microdontia, where is the size of the tooth which is present, that is smaller than the normal tooth. Okay, so micro implies smaller. Micro implies smaller. It is smaller than the normal. Now we'll see types. There are also types, like it is generalized, like it is localized, or what. Okay, so first of all, we'll see true generalized, relative generalized, and involving single tooth. Okay, now involving single tooth microdontia, that is the most common anomaly, most common type of microdontia that you can see. Now this one involving single tooth, which it affects mostly which teeth, that is important thing. Okay, so generally most commonly microdontia affects single tooth, maxillary lateral incisors, and third molars. Now these tooth you should be knowing. Okay, and this third molar, they are generally congenitally missing. Now we'll see true generalized and relatively generalized. Now see what is the meaning of relative, what is the meaning of relative, what is the meaning of true. Relative means jaws are comparatively larger and the teeth appear relatively smaller. Then that condition is known as relative generalized. So we see small teeth are there, jaws are larger in comparison to the ratio, the proportion of the teeth. When you are seeing, then teeth appear smaller than the jaw. And generally this cause of relative generalized microdontia is hereditary. Now this you should know. Okay, the cause of relative generalized microdontia is hereditary. And if you see for true generalized, here is what? Here all teeth are small in size. All teeth will be small in size, and it is there generally in the case of pituitary dwarfism. So you should know the clinical cases and the classical examples. The classical examples also you should be knowing, plus if involving single tooth, then which tooth is the most common, that is maxillary lateral incisors or third molars. Now we will see localized microdontia. See, it is also known as generally peg laterals. Peg laterals are an example of localized microdontia. See, peg laterals, cone shaped. These are cone shaped, and the teeth which are most commonly affected in peg laterals, these are maxillary lateral incisors. Okay, so you should know this. Peg laterals are maxillary lateral incisors. Okay, and what happens there? The sides will taper together towards incisor. Okay, thus see, this image is showing microdontia. You can see lateral incisor small here. See, this is a small, this is microdontia. Okay, this is not the case of peg lateral, this is microdontia. In case of peg lateral, if you want to see, that will be tapering sides will be there incisally and roots will be shorter. Now next one we will see, that is macrodontia. Now here macro implies larger, large, macro is large. So these macrodontia, the tooths affecting from macrodontia, they are larger than normal. Okay, now this is also of three types: true generalized, relative generalized, and involving single tooth. Now if we talk about single tooth involvement, see, if single tooth involvement, that is uncommon, that is generally confused with fusion. Okay, that is generally confused with fusion. And relative generalized is what? Similarly, the opposite of relative generalized microdontia, this is large teeth and jaw is relatively smaller in comparison to teeth proportion. So the cause is hereditary. Relative generalized cause is hereditary. Now we'll see true generalized, and this is rare. True generalized is rare, but the causes, these are pituitary gigantism. All teeth are large, and the case is pituitary gigantism, where you can see the true generalized macrodontia. Now you can see this. See, this is a clinical picture. This is a clinical picture showing relative macrodontia. Now see, all other teeth, see the teeth and the jaw. So jaw is appearing smaller in comparison to the teeth when you see the proportion. So this is relative macrodontia. Now we'll be seeing some important points, very important points which are presented here as meritorious prefects, and these are direct important terminologies which you can expect as questions. Okay, so see, first of all we'll see rhizomegaly or radiculomegaly. Now first of all you can understand the meaning of this term. See, rhizo is root and megaly is enlargement. Okay, so now easily you can get the meaning here itself. See, radiculomegaly or rhizomegaly implies what? Longer roots. Now you should know what is the tooth which is affected. That is important in this case. Rhizomegaly can be seen in mandibular canines. You should know the tooth which is affected in rhizomegaly. Now similarly we'll see rhizomicry. Now what is rhizomicry? Rhizo is root and micry is small. Micro is small. So shorter roots, rhizomicry. These terminologies are important. Now we'll see globodontia. What is globodontia? Globodontia, canines and molars are enlarged without any effects on incisors. Okay, incisors are normal only, normal size, but canines and molars will be enlarged. So this condition will be known as globodontia. Now next one, syndrome which is associated with globodontia, otodental syndrome, eye coloboma and hearing loss. Okay, so otodental syndrome is there, that is associated with globodontia. You should know the syndromes. Otodental syndrome associated with globodontia, it is autosomal dominant, FGF3 mutation is there and eye coloboma is present plus hearing loss is present. Now we'll see the disturbances in shape of teeth. Okay, and these terms, gemination, twinning, fusion, you should be able to differentiate between all these. Okay, so first of all we'll see gemination. Now what is gemination? Here at a single tooth germ is dividing. It is dividing and forming two incomplete teeth. Okay, two incomplete teeth will be formed by division of a single tooth germ, and two crowns and one root is formed. See the picture. Okay, see, this is a picture and this is a clinical picture, intraoral picture. And see the twinning. What is twinning? Now should be able to differentiate between gemination and twinning. In gemination, a single tooth germ is dividing to form two incomplete tooth, whereas in twinning there is a division. Division is leading to equivalent structures. Okay, equivalent structures are formed by division, wherein one normal tooth is there plus one supernumerary tooth is there. So now you know twinning is one normal tooth plus one supernumerary tooth just formed due to the division of a single tooth germ. Now next ones we'll be talking about, that is fusion. Okay, so you should be clear with all the terminologies like gemination, twinning and fusion, because these are confusing, but these are all different terminologies and you should be clear about them. So see what is happening in fusion. In fusion, two separate tooth germs are uniting. Okay, in gemination, one single tooth germ was splitting. Okay, so when one single tooth germ was splitting, that was forming two incomplete tooth structures, two crowns and one root, that was being formed in gemination. In case of twinning, what was happening? Two equivalent structures were being formed. We were getting one normal tooth and we were getting one supernumerary tooth. Now this is a case of fusion. Here two tooth germs, two separate tooth germs they are uniting. Okay, here two tooth germs involvement is there. In those cases, only one tooth germ was involved. Now I think this should be clear by now. Now union of two separate tooth germs is more common in primary dentition. Now this is also a question. Fusion is seen most commonly in primary dentition. Okay. Now in this condition, when two tooth germs are fusing, okay, they are uniting, then root canals may be separate also or may be fused also. Both cases can be there. When fusion is occurring before the calcification of tooth, then two teeth will completely be united. Okay, but if it is occurring after calcification, then only roots will be united. Now you should see this and you can appreciate the fusion. See this one, two tooth germs are fused here. This is the fusion case and this is the radiographic appearance. Okay, and this is the clinical intraoral picture. Now next one is concrescence. Now concrescence, here is the clue is cementum. Okay, so here teeth are united by cementum. They are united by cementum only, means after complete root formation. And most common tooth which are affected, these are maxillary molars. Concrescence, see the picture. the clinical picture of two teeth. Concrescence is there. Their union is by cementum only. Causes are due to trauma also this can occur, and due to teeth crowding with interdental bone resorption, this concrescence can occur. Now next one is dilaceration. Dilaceration implies angulation or bending or curving in root or crown of formed tooth. Okay, the most common cause is trauma, and this is asked as a question. Most common cause of dilaceration is trauma. Okay, or you may be getting this picture and then the question will be most common cause of this condition can be. Then you should be first of all identifying this picture that this is dilaceration. Then you should be knowing that what is the most common cause of dilaceration, and that is trauma. Now next one we will be discussing is Talon's cusp. Talon cusp, it is called as Talon. Why? Because it resembles eagle's talon. Okay, and the most common teeth which are affected, they are important. These are maxillary, mandibular, permanent incisors. A lingual projection is there from cingulum. See, this is maxillary, central incisors, permanent incisors, and projection is there from the lingual side. See this projection. Okay. Associated syndromes. Now these associated syndromes are very important for Talon's cusp. These are Rubinstein-Taybi syndrome, Sturge-Weber syndrome, and Moore syndrome. So you can learn these as RSM. Okay, RSM. This is Rubinstein-Taybi, this is Sturge-Weber, and that is Moore syndrome. And see, this is a clinical picture. From the projection from the lingual side, this is a projection, talon-like projection from the lingual side of maxillary permanent incisors. There is a classification system. A classification of Talon cusp is done by Hattab, so called as Hattab's classification of Talon's cusp. And in this classification, it's a very simple classification. There is a true talon, semi-talon, or trace talon. So you may get it as, if it is not given as true talon, then it is major talon, and major, minor, and trace talon. These are the terminologies which are used here in this classification. Now dens in denti. See, dens in denti, this is very important, and you should know the tooth which is most commonly affected, and it is dens in denti, means tooth within tooth. Okay, this is tooth within tooth, means crown surface invagination is there before calcification. Now see the synonyms. Synonyms are dens invaginatus, it is also called as dens invaginatus, or dilated composite odontome. Causes are localized external pressure, focal growth retardation, or focal growth stimulation in certain area of the tooth bud. And very important thing, the most important thing of this is most common tooth which is involved. The most common tooth is a maxillary lateral incisor which is affected by dens in denti. You can see the clinical picture here. Okay, see the clinical picture. See the clinical picture of dens in denti, and this is very important. This thing, the tooth which is commonly affected, that is maxillary lateral incisor. Now we'll see some important points. See, first of all, radicular dens in denti, like same as we saw for coronal dens in denti, where the invagination of the certain part of crown was there. Similarly here, tooth root invagination will be there in radicular dens in denti, and the cause will be Hertz infolding. Hertz is what? It is Hertwig's epithelial root sheath. The infolding of the Hertwig's epithelial root sheath is the cause for radicular dens in denti formation. Radiographic appearance will be pear-shaped invasion of enamel and dentin plus narrow constriction at the surface opening can be appreciated in the radiograph. Okay, now we'll see certain terminologies. So first of all, see schizodontism. This is schizodontism. This is what? This is division or cleavage of tooth germ during development. That is known as schizodontism. Synodontism, that is, syn means this is fusion of tooth germs with supernumerary tooth during development. Okay, so fusion of tooth germs with supernumerary tooth is occurring in synodontism. And next one is conated teeth. Now conated teeth, these are double teeth. Here gemination is also there and fusion is also there. Now similar to dens invaginatus, we have another anomaly, that is dens evaginatus. So it is an evaginatus. Here what will be there? See, like there was an infolding, but here some globule will be present on this occlusal surface. Okay, So it is also known as occlusal tuberculated premolar or Leong's premolar. Leong's premolar and evaginated odontome or occlusal enamel pearl. See, on the occlusal aspect, a mass is present, okay, enamel globule on the occlusal surface of premolar is present. So most commonly affected teeth, premolars for this dense evaginatus, and most commonly affected race, mongoloid ancestry people. Now this race is important. This race is important for dense evaginatus. Okay, this is characteristic. They are most commonly affected race is mongoloid ancestry people, and you should know the tooth, that is premolar, and the other names also are important, and see the clinical presentation. Enamel pearl. Now see, enamel pearl synonyms are enameloma or enamel drop. What happens in this? Enamel nodule, globule or knot that will be present on CEJ or cervical third of root. Okay, on the cervical third of root you can see an enamel nodule, globule, anything can be present. Okay, so that is known as enamel pearl or enameloma or enamel drop. Now similar anomaly is what? Cervical enamel extension. That is, enamel formation will extend beyond the cervical line of the crown. That is similar anomaly. Now clinical features, see, yellow white, it will be yellow or white in color. Root furcation area, it is present, see, it is present at the furcation area. 1 to 3 mm diameter and prevalence is 1 to 15%. Okay, so important things are its location, root furcation area, important thing. Okay, and most commonly affected tooth. Most commonly affected tooth, maxillary third molar. Now next one, and very important, that is Taurodontism. Okay, and it was described first by Sir Arthur Keith in 1913. It is called Taurodontism, means bull-like. Okay, bull-like, similar to the molar teeth of cut-chewing animals. Okay, now tooth body is enlarged at the root expense. See, you can see this is the normal tooth. This is the normal tooth. Now this is hypotaurodont. This is a classification given by Shaw. Here the taurodontism has been classified. See, first of all, hypotaurodont. It's not like that. This is a mildest degree which can be seen. This is meso, okay, in between something, and this is the extreme thing. See, the pulp chamber is so much enlarged. This is rectangular shaped teeth. Rectangular shaped teeth. This is the radiographic appearance, and the tooth body is enlarged at the root expense. See, root has become so less. Root has become, the furcation is so down, and this is the whole pulp chamber. It is so wide. So it is also known as rectangular shaped teeth on radiograph. And now you got the classification also, classification by Shaw. This is normal. Normal is known as cynodont. Now this term you should know. This cynodont is normal. Do not confuse that this is also a part of classification. This is the normal tooth. Now then hypo, meso and hypertaurodont are the other terms. Now we'll be seeing the causes of taurodontism. Okay, see. It is a specialized retrograde character. It is a primitive pattern. Okay. All these are asked questions. It is a Mendelian recessive trait and atavistic feature. Now this is a question. Taurodontism is an atavistic feature. Okay. Now why this happens? This happens due to the failure of hairs to invaginate at proper horizontal level. Okay. Hairs is what? Herdwick's epithelial root sheet that fails to invaginate at the proper horizontal level. So this taurodontism happens. Now some syndromes are associated with taurodontism, and these are important. These are Klinefelter's, Downs and amelogenesis imperfecta. These are the syndromes which are associated with taurodontism. These you should know. Okay, these are important. It is more common in permanent than deciduous dentition. Now this is important thing. Taurodontism is most common in permanent than deciduous dentition, and most common tooth is molar. Okay, most common tooth is molar. Now next one we'll be seeing, that is supernumerary roots. Now supernumerary roots are present in, supernumerary means more than normal roots are present in mandibular cuspids and bicuspids. Okay, mandibular cuspids and bicuspids have supernumerary roots, plus another set of tooth which has supernumerary roots. These are maxillary plus mandibular third molars. Now we'll be discussing some frequently asked questions from this topic. Okay, basically you get image based questions and some terminologies are also asked from this. Okay, so we'll see first question. See, a 12-year-old male patient came with a large tooth as seen in this color plate. See this color plate. Now on examination, number of teeth is 1 less than normal. Now this is the clue. What is the diagnosis? See, you can see a large tooth present here. A large tooth is present here in place of central incisor, maxillary, and one tooth is less than the normal, like total count is 24 if, then this patient is having only 23. It implies either one is missing or two have fused to one. Now, one is missing is not the case here. You are not seeing any gap or something. So, see, you go for fusion. First of all, you will go for fusion. So, when two germs are fusing to one, then a large tooth is being formed here. So, it's an exceptionally large tooth in the arch, see. So, that is the result of fusion of two central incisors. So, now here the answer is fusion. So, now you can correlate it with the history also, means the examination findings. The examination findings are what? These number of teeth is 1 less than normal plus the clinical picture. The clinical picture that is given along with the question. Now, we'll see the next question. See, identify the structure marked with an arrow in the color plate. Now, see this picture, the picture which is provided here. See, a projection is there. The projection is there on the lingual aspect of anterior teeth. Now, out of all these, see dens in denti. No, it cannot be dens in denti. Cingulum cannot be that prominent. Cingulum cannot be that prominent to project inside the cavity. Okay, see. Now, next one is Talon's cusp. Yeah, this should be Talon's cusp because the fourth option, dens invaginatus, is the same as the first option. Okay, so here the answer will be Talon's cusp. You should be able to identify. You should be able to identify this anomaly, as you may get direct questions based on image. The images, the clinical features, I have shown you lots of them. I have shown you lots of them pertaining to each clinical conditions I have shown. So, these images are very important. Okay, now next question. See here, it's a radiograph. A radiograph is given in the color plate. See, identify the condition shown in the radiograph. Now, you should be able to appreciate the morphology here. This is the normal tooth. Okay, this is the root and abruptly bent root. This is okay. This is abruptly bent root and this is marked by an arrow also. Okay, so that condition is being asked in the question. See the options: concrescence, dilaceration, odontoma, root fracture. Now this is abrupt bending. This abrupt curvature is dilaceration. You all know it cannot be concrescence. Okay, it cannot be concrescence. It is dilaceration. It cannot be odontoma, and this is not a root fracture. So here answer is dilaceration. So now you've got many questions I have discussed here. Sample questions I have discussed. I have showed you all the clinical pictures of various conditions also. I have told you the important questions which may come from this topic, and you may expect like IBQs, basically IBQs based on the basis of the clinical conditions like I am showing here. Okay, so prepare this topic well, go through the synopsis, go through the video again. If you want to read in detail, you can read textbooks like Schaeffer's, Neville's, and prepare this topic well. I hope this topic was clear enough, but if you still have any queries, you can comment in the comment sections below. If you like this video, like and share the video, subscribe the channel and hit the bell icon if you want to receive future notifications for the upcoming videos. Thank you.